sunshine. It's our sunshine.
Hello friends, I am Dr. Sampurna Ghosh. I am ENT consultant in Hyderabad working in Sunshine Hospital, Gachibowli. Today's topic is about headache. I know that is the most common and nagging symptoms in many people's life, and many of you are clueless why you get headache, what are the reason and how to treat it, and some people Google about headache and reach up to brain tumor, but you have to know what are the common cause of headache and how to get rid of it even without medicine by simple lifestyle modification. Common causes of headache are, number one is vascular headache, which include migraine, tension type headache, cluster headache. These are mostly related to stress, bad food habit, bad sleep habit, basically lifestyle related. The other common cause of headache is sinusitis related. The rare causes are the problems in the brain, some medical problem or some tumor, but that is really rare. So when you come to a doctor for headache, first we need to understand which category of headache you have and then investigate accordingly. Migraine is a disease which is caused by basically three major issues. One is sleep deprivation or bad timing of the sleep. Number two is not taking food at proper time or taking wrong quality of food, lot of caffeine intake or the soda water or aerated the drinks, lot of dark chocolate, ice cream. These are all the food causing headache. Also the ajinomoto, which are many a times present in the restaurant Chinese food. So these are some food which can provoke the headache like migraine. The second thing is stress, mental or physical stress. Number three is sleep deprivation, which I already talked about. What do I mean by stress? There are people who simply on a long journey, in a car or a train journey, they get headache. So there are people who before exam or before an interview or when they are working too much continuously in the laptop, that is stress for them. So stress is a general term which may be different for different people. So how to control the migraine? Very important and relevant question. It is actually not that difficult if you try to follow a traditional lifestyle. So remember what our childhood used to be, what time we used to go to bed early by 9 o'clock or 10 o'clock and wake up early and have proper breakfast and go to school at a particular time, having tiffin or lunch and then early dinner and go to bed. Those days, I'm talking about the 90s or early 20s, we didn't have smartphone, we didn't have laptop, we didn't watch so much series in the Netflix, Facebook, Twitter. Nowadays, the so-called modern lifestyle has caused a havoc, bad effect on our mental and physical health. Not even the adults, but also the children, they have to do online classes for 3-4 hours during the lockdown. After that, they are again watching iPad, they are watching cartoons and YouTube videos. This is bad for the child's mental and physical health, as well as an adult who is spending hours in a laptop, suppose an engineer or whatever profession. Then for the entertainment, again they are opening the television or the laptop. So all these are called screen time. Increased screen time is increasing the problem like headache both in children and adult. So try to reduce your screen time, try to do things you used to do in your childhood, the other hobbies, reading storybooks, doing gardening, doing some art and craft, or just go out for a walk simply. So little bit of exercise and meditation, reading good book and listening to music will not only reduce your stress, it will boost up your immunity, your overall well-being, and it will reduce the headache like migraine. Migraine is also very common in women more than men because of the hormonal ups and downs. For ladies also, it is very important that other than their household activities or office work, they spend some time for their own. They must do half an hour walk or jogging or yoga that will help to reduce their migraine pain. And even after that, if it is not going down, we have to take help of the medication. There are two kinds of medication. One is called prophylactic drug. These are the medicines which gradually reduces the frequency and severity of migraine. These kind of medicines, when your doctor will prescribe, you usually have to take it for 1 month, 2 months, like that, to understand whether it is helping you or not. If you take for a week and stop, it is not going to help you. So prophylactic medications are for long-term use. And there is a second group of medication which is given when you have the headache. Normal paracetamol and painkillers sometimes don't give relief in the migraine patients who have especially very bad migraine. Then you have to ask your doctor what is the migraine specific drug you have to take at that particular time to get rid of the headache. If your headache is not looking like migraine nor like sinusitis, sinusitis part will be treated by the ENT surgeon, but suppose it is not falling into any of these categories, then you need help of a neurologist. So that time we ask for MRI or CT scan brain and look what is the cause of the headache. So what is the take home message today? Don't think that all the headaches are sinus headache. It's a myth. The people who have sinus headache, they will also have lot of nasal symptoms like nose block, thick discharge from the nose, bad smell or loss of smell in the nose, repeated cough and cold. Along with that, if you have headache, probably you are dealing with sinus headache, which we confirm from a CT scan of the sinus and endoscopic examination and treat accordingly. But suppose you have nothing in the nose, no complaint, but you get pain in one half of your face and head, and you get the pain if you didn't take your meal at proper time, if you are on stress, and you feel little nausea or vomiting tendency along with the headache, then you can suspect your headache is more on the migraine side. So the treatment are totally different, and if it is migraine, good for you, because simply lifestyle modification can help in 80 to 90% of cases if you really follow the traditional good healthy lifestyle. Thank you.
Sunshine, it's our sunshine.